Hello, my name is Cynthia Jackson-Gonzalez, and welcome to my Parent and Family Resource Manual on Selective Mutism. Today, I'll be sharing information, resources, and strategies to support children with selective mutism and their families. Selective mutism is an anxiety disorder where a child is able to speak but is unable to in certain situations, like at school. Children with selective mutism usually speak comfortably at home or in familiar environments. Some common characteristics include a consistent inability to speak in certain situations, relying on gestures or facial expressions instead of words, and appearing frozen when they're expected to talk. This condition is often rooted in social anxiety, sometimes linked to a family history of anxiety disorders, and is commonly associated with shyness. Risk factors can include a genetic predisposition to anxiety, a naturally shy temperament, stressful or traumatic childhood experiences, and even multilingual or bilingual environments, which may increase social stress but don't necessarily cause selective mutism. According to the DSM 5, selective mutism is defined by several key points. The child consistently does not speak in certain social situations, even though they can speak in other settings. This difficulty interferes with school, friendships, or other important areas of life. The problem lasts for at least 1 month. The child knows the language expected in that setting, and the difficulty is not caused by another communication disorder, autism spectrum disorder, or other mental health conditions. Selective mutism affects about 0.2 to 0.8% of children. It's usually diagnosed between ages 3 and 8, is often first noticed in school, and occurs more frequently in girls. San Diego offers several excellent resources for families. I started by listing the Selective Mutism Association. It's not necessarily local to San Diego, but they do have a lot of online resources, webinars, and family support. There's also a feature where they will find providers that specialize in selective mutism near you, one of those being San Diego. Then we have the San Diego Center for Speech Therapy, which offers child centered intervention and social skills groups. And then Pinnacle Counseling and Psychological Testing Center provides individualized testing, evaluations, and therapy for children and families. Now we have some additional resources. We have OT with Whitney, who specializes in selective mutism and works in schools to support children's sense of safety and confidence using connection based therapy. We have San Diego Youth Psychology offering parent child interaction therapy for children ages 2 to 7. And we have Dr. Lynn Lunsford. She's a clinical psychologist providing therapy for children and families, including support for children with selective mutism. She's been practicing for, I think, 25 years. She's been on the news. She has a lot of really good resources for selective mutism. Research shows that children with selective mutism benefit most from early structured interventions. The first study that I've listed here is the treatment of selective mutism, follow-up studies 1 year after end of treatment. This study followed children with selective mutism for 1 year after they completed treatment. The results showed that most children maintained improvements in speaking behaviors, which highlights the lasting effect of structured intervention. Then we have behavioral treatment of selective mutism, a 5-year follow-up study. This research examined long-term outcomes of behavioral strategies for selective mutism. Gradual exposure and positive reinforcement were effective in increasing children's verbal responses over time. And then selective mutism, a review of etiology, comorbidities, and treatment. This review summarized practical intervention strategies for parents and teachers, emphasizing consistent support in daily routines, school settings, and social environments to help children gain confidence and speak more freely. The takeaway is that combining behavioral interventions, parent guidance, and school collaboration is key to helping children gain confidence and increase speech. Families with multiple children can face unique challenges when one child has selective mutism. The Unspoken Words podcast, episode 42, titled Managing Unique Sibling Dynamics, offers strategies for supporting siblings while promoting empathy and healthy communication. The QR code there will take you to the YouTube video of the podcast. Then we have the SMA blog post titled Siblings and Selective Mutism. It provides practical advice for parents, basically saying give siblings one-on-one attention, normalize challenges, and encourage siblings not to speak for the child with selective mutism. These resources can help families maintain balance, support all children, and build stronger relationships. For parents, here are some helpful guides. First, we have Supporting Your Child with Selective Mutism, a practical guide for school, home, and in the community. Provides step-by-step strategies such as graded questioning, buddy systems, and voice exposure with real examples from school, playdates, and community activities. And then we have Overcoming Selective Mutism, the Parents Field Guide. Offers a journey-themed approach with research-based strategies, worksheets, and practical tools to encourage children to speak in school with peers and in the community. For children, here are two great storybooks. First is Rose's Silent World. It follows a shy girl called Rose who finds her voice with encouragement from a classmate. This book is meant to help children understand their feelings, build self-esteem, and face challenges like shyness or selective mutism. And then we have a book called My Name is Ben and I Don't Talk Sometimes. It's told from a child's perspective. Ben shares his experiences in school, play dates, and birthday parties, showing small steps towards speaking. This story can help children relate to Ben, and it serves as a tool for parents and educators to begin conversations about selective mutism. Hi everyone, my name is Cynthia, and today we are going to go over a quick and low-pressure activity that families can do at home to support their children with selective mutism. To communicate. Super quick and easy. All you need is 2 cups and some beads for them to drop into the cup depending on their choice. The cups are labeled yes and no, so we start with simple questions. The purpose of this activity is to support communication, any form of it, whether it be they point to a cup or they drop the bead into a cup as the activity is intended. Or even whisper if they're comfortable. So, for example, you can start by asking them, do you like pizza? And then if, they drop a bead into the yes cup without saying anything, you can say, oh, pizza, yes, okay, great. Good job making a choice. That was an easy one, huh? And then you could ask another question like, do you like broccoli? And then they can shake their head or they can drop a bead into the no cup, and then you tell them, okay, no, thank you for telling me. And really the whole purpose is just to not force them into speaking. You don't want to tell them, okay, no broccoli, say it, because you're just adding more pressure, which is they're already feeling so much pressure to speak. But really this activity is just meant to give children a safe space to communicate in their own way, and getting to know them without them needing to feel pressured to speak up out loud. Thank you. Before we finish, here are the key takeaways. First is that selective mutism is an anxiety disorder. It's not stubbornness or defiance. Early intervention and family involvement are essential for progress. San Diego has excellent resources for parents, siblings, and schools. And most importantly, families are not alone. There are support groups, books, and activities that can make a meaningful difference. Thank you for your time and attention. I hope this presentation has provided useful information and practical resources to support your child and your family. Happy to answer any questions you might have.